As moms, these three women focused on everyone else, but now it's their turn. Get ready to share this journey with them and start thinking about making it your turn too. Meet Harmony, a young mom of 7 children who wanted a change to her tummy and breasts, but didn't want to look overdone.
Hi, Harmony. I'm Dr. Lawton.
Hi, nice to meet you.
Nice to meet you. Okay. I usually like to start by asking what procedures you're most interested in.
I have concerns with my stomach.
Okay.
And then also breast augmentations.
Most people have concerns about their tummy and their breasts. Sometimes more than that, but those are usually the main focus for most women. It's different for everybody, but let's start with talking about your breasts. A lot of people don't understand the changes that happen when you have pregnancy, breastfeeding, and all that. And a lot of times women end up with a breast that appears more deflated. Sometimes the skin is loose, sometimes they're larger than they were before pregnancy, sometimes they're smaller. What type of changes did you notice on your breasts?
Definitely flatter.
Flatter, okay.
And they sag more than they did before.
Okay, do you have loose skin?
Yes.
Most of the time when women have that deflated look, an implant can give them that fuller look that they're looking for. And then when you have loose skin, really the only way to deal with the loose skin is to do a lift or a mastopexy. So we'll talk a little bit about what that entails to do both of those procedures, okay? I like to put the implants underneath the pectoralis major muscle. So we make an incision at the bottom of the breast, access the underneath side of the pectoralis muscle, make a space for the implant, put the implant in that space.
Okay.
The second portion of the operation is called a mastopexy, or that's the lift, and that's where you're going to get the skin tailoring. It requires some incisions in order to get that lifted appearance in the breast.
Okay.
Okay. I like to just draw it for you so you get a better understanding of the scars that you'll have on your
Sure.
body afterwards. So most of the time when women's breasts sag or droop, we call that ptosis. The nipple realar complex ends up being more towards the bottom of the breast. And so we're going to make some incisions, and they've termed this an anchor pattern, or some people call it a Weiss pattern. And that's what the incisions will look like on your breast. But what you end up with afterwards is a more compact, lifted breast with a scar that goes all the way around the areola.
Okay.
One in the front of the breast and then one in the crease. Obviously, the amount of scarring you have, I'm going to minimize as much as I can, but tailor it towards however much skin you need removed.
Okay.
Okay, does that make sense?
Yes, absolutely.
Natrelle silicone-filled breast implants. Important information. Who may get breast implants? Indications. Natrelle silicone-filled Natrelle Inspira and Natrelle 410 shaped gel breast implants are approved for women for the following: breast augmentation for women at least 22 years old for silicone-filled implants. Breast augmentation includes primary breast augmentation to increase breast size, as well as revision surgery to correct or improve the result of a primary breast augmentation surgery. Important safety information. Who should not get breast implants? Contraindications. Women with active infection anywhere in their body. Women with existing cancer or pre-cancer of their breast who have not received adequate treatment for those conditions. Women who are currently pregnant or nursing. What else should I consider? Warnings. Breast implants are not lifetime devices and not necessarily a one-time surgery. Many of the changes to your breasts following implantation cannot be undone. If you later choose to have your implants removed and not replaced, you may experience unacceptable dimpling, puckering, wrinkling, or other cosmetic changes of the breast, which may be permanent. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent and may not be detected by you or your doctor. You should have an MRI 3 years after your surgery and then every 2 years after that, for as long as you have your breast implants to determine if rupture is present. If implant rupture is noted on an MRI, you should have the implant removed with or without replacement. With breast implants, a routine screening mammography and self-examinations for breast cancer will be more difficult. Ask your doctor to help you distinguish the implant from your breast tissue. Symptoms of a ruptured implant may be hard knots or lumps surrounding the implant or in the armpit, change or loss of size or shape of the breast or implant, pain, tingling, swelling, numbness, burning or hardening. Tell your doctor of these symptoms and remove ruptured implants. Inform any other doctor who treats you of the presence of your implants to minimize the risk of damage to the implants. What types of conditions require more study? Precautions. Caution: notify your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher. Autoimmune diseases, for example, lupus and scleroderma. A weakened immune system, for example, currently taking drugs that weaken the body's natural resistance to disease. Planned chemotherapy following breast implant placement. Planned radiation therapy to the breast following breast implant placement. Conditions that interfere with wound healing and blood clotting. Reduced blood supply to breast tissue. Clinical diagnosis of depression or other